Scott and Steen have done some incredible things in their organization, and I'm excited for you guys to learn more about it. So, Mad, take it away.
I want to say before we get started that I worked with Charlie a couple of years ago on a particular issue with Michael Best, and similar to Liam Neeson in the movie Taken, he's got a unique particular set of skills. And I would certainly encourage you to keep him somewhere on your Rolodex so when a unique situation comes your way, you have a subject matter expert on some very intricate law, which 50% of the time you think, that can't be legal. You know, we can't do this. Before you say that, give him a call because he can really share with you. You heard the gentleman up here quote a regulation or a number, and when you've got that kind of knowledge of the law, you know you're dealing with a subject matter expert. So shout out to Charlie and Michael Best.
Well, this is a fun one. So before I jump in, I was going to have you guys do some introductions. So just a little bit about yourself, your role, your entity, and how long you've been with Self Fund.
Sure. Okay, so I'm Dr. Scott Sabol from Mayville School District. This is my 16th year of being a superintendent in the state of Wisconsin. It's my 10th year at being at Mayville School District. We have, as a school district, I have 82 employees on the insurance. We have about 200 employees.
And how long have you been with Self Fund?
We just finished year 1.
Woohoo!
And loving it.
Steen?
So I'm Steen Coleman. I'm Chief Financial Officer of Paper Machinery Corporation in Milwaukee. We've been a client of Self Fund. This is our second year, so not a complete second year yet. And I kind of got into this a little bit on happenstance. We were fully insured, and as a CFO, I'm obviously looking for cost savings. And my HR manager, who's normally kind of the partner in these things and the one that's kind of starts the discussions and driving it with your broker, he was a year away from retirement. And it's not something that someone a year away from retirement wanted to necessarily take on. He didn't necessarily tell me that, but you can read people pretty easy, and you can't go into these things without a partner because there's a lot of work involved in it. So again, I went in it selfishly for cost savings and then realized there was so much more to it. And, you know, we were bumping up against a renewal, and I had a very innovative broker, Cammie Wine from R&R, that kind of talked me into it. And because I wanted to go self-funding, but I think I heard it, you know, walk before you run. And so I just wanted to gradually work my way into it. And I think because of her energy, enthusiasm, and innovativeness, I had the confidence to move forward with it. So anyway, this is, we're a year and a half into it. There's been some really great stories, and there's been some ones that I'd rather forget. But that's the nature of being self-funded. So.
Yeah, I mean, that's a perfect segue into my first question. So I guess, Scott, I'll ask you kind of what helped you make the leap and being mindful that we have brokers and employers here. Some brokers who are, how do I get my employers to do this? And some employers who are feeling.
I'm just a truth speaker. You're going to get what you're going to get. So, you know, Steen had a story where his broker was working with him as kind of a journey. Sounds like it was not just a leap of faith. So as a public school system and working in a small rural school district, our county is Dodge County. It is a actual healthcare desert. Designated as that. I go down all the other things it's missing as well. Rural Wisconsin's missing a ton, everybody. So with that, my employees drive from all over the state of Wisconsin, and we have to keep a wide network. Well, what's the trend happening in insurance today? Narrow networks, taking away benefits, good times, right? So as a superintendent for 15 years, I just keep taking away benefits from people. We just keep increasing co-pays. Next thing you know, we have high deductible health plans with HSAs that we're helping to fund, and we're convincing ourselves that this is good. It's not good. That's horrible, I want you to know. So I'm on the other side of this and realize, no, this is not a good thing. We've been sold a bag of goods. So after getting another 15% renewal and then getting that down to a 10 and being like, hey, this is good, Like, come on, we can do something else. So we had been looking at a captive. We had talked about a captive earlier, and turns out that captives for public schools, literally at that window, so this is a little over a year ago, a judge had ruled them illegal. So you have to be, public has to be with public. You can't commingle public and private in a captive, it turned out. So it was literally up in the courts and just ruled that. So that was pulled off the table. And then I said, well, what about looking at self-insured? And literally the conversation being told to most public school systems is you're too small. Okay, that is it. Or back in the day, like this district before me, many years ago, we're talking like 25 years ago, was self-insured, and it did not go well. And then all of the billing is coming to their little finance department, paying every single bill. Like those are old school models. So there's a lot of fear and concern based upon the old school models. So when we had a chance, a different broker brought in self-fund health. And to me, it was just like, well, hey, this is a new day. This is a new system. I didn't have a lot of fear. One of my things is with a doctorate in leadership, it's all about innovation, thinking outside of the box. And I think self-fund health is very, not only that, but also very paternalistic, maternalistic. And I love that. So that came out loud and clear throughout all of that. Their responsiveness is amazing. Our story was brutal renewals over and over and about to take away more benefits, and on the good side at 10%. But as I was thinking the past couple days, 10% 7 years ago is really different than 10% now. When you're looking at a $2.5 million health insurance plan at 10%, that's a big increase compared to the back in the day, like 1.6 million. You know, so those stats really matter.
Definitely.
I will add to that you talk about leap of faith. So when you're considering going self-funded, there's levels of going self-funded. There are some that aren't that much of a change than being fully insured, other than you hire a TPA to process your claims and you cut a check for all of the claims, but everything else kind of looks and feels the same. And you have access to the data, but you don't necessarily have tools that you can take action with the data. And data is only good if it's actionable. The self-fund health plan really kind of is that third tier. And I would say it's a leap of faith. But we did run some numbers. And again, have a broker that's analytical, that's data-oriented, and have them model. I mean, I'm a numbers guy, so you got to model that to make sure before we take this leap that I've got a good chance of success here and that I understand all of the partners and all of the fees associated with it. And that way, it's not such a leap of faith. You actually go into it with some data and some level of confidence that you'll be successful.
And this is not intended to be a self-fund health commercial, right? Because it's about self-insurance. But I will tell you from working with brokers now for 15 years that, and having different insurance, we've jumped around because that's another way too. Let's keep changing insurance, everybody. Here we go. They'll buy you for a year, they'll buy you for another year, and then wham, giant renewals, okay? And that's so frustrating to your staff, to your employees. So the one part that I think is so different that we just experienced over the last year is that our actual self-fund health Alliant Trilogy partnership with the nurses, with the DPCs, it really is a partnership. I can pick up the phone, I can text, I can call. I've never had such a responsive group of people. And when you experience something, they're problem solvers.
Yeah, definitely a different experience. That's a great segue into the next question, which is, when you decided that's what you were doing, how did you roll it out to employees and what kind of response did you get? Steen, why don't you take that one first?
Yeah, I'll take that one. So it was during our annual enrollment meeting, and at the time, you got to come prepared for it. So when we originally decided we were going to go forward with this plan, we wanted to meet all of the partners involved, the DPCs. I mean, we went to every location, met the doctors, the nurses, looked at the facilities, looked where they were located, trying to envision what our employees' experience would be like, because I didn't want that to be a surprise, and nor did I want to go down a path that I didn't feel comfortable with. So anyway, we, had the facts in terms of what the structure was. We had just gone through a fully insured quote where we had a double-digit increase. And so kind of one of the first things I did in the meeting, kind of the announcement before that, hey, we're going self-funded, was, hey, we got our renewal, and everybody's premiums are gonna go up 11%. And then I said, just kidding. We're gonna put some things in place, some tools in place to avoid that. And the way that we designed this plan was low risk to the employee, meaning we kept one side, we kept the traditional plan that had all of our deductibles, co-pays, out-of-pocket maximum, nothing changed there. If anything, we actually, with the Trilogy Network, expanded our resources because we were in a narrow network, and we actually expanded the network through Trilogy. So if anything, we gave them more choices. But then we added that saying, you can still do all of this if this is where you feel most comfortable. But we're also going to introduce an option that's not going to cost you anything. And then that's when they perk up. What are you talking about? That's too good to be true. And then we kind of went through, and at the time, I thought maybe it was too good to be true. That's just kind of the way we structured it. And I was, really, does this independent network exist out there, or do they have enough coverage for all the different healthcare that exists in the world? Because let's face it, you've got brain surgery and cancers here, and you've got colds and infections here, and there's so much healthcare in between those two, and that's where your focus is going to end up being. So did we have enough coverage within this independent network that our employees would be able to get the care they needed? So the approach was not the stick, it was the carrot. Hey, if you're just risk averse and you don't want to try it yet, we've got your traditional plan that you can go that way. But recognize if you have a surgery, if you're going to be $6,000 out of pocket, we're going to give you an option to try here, and we're going to try to educate you and introduce you to some of the partners so we would gain some confidence. But that's how we rolled it out to them. So it made it kind of easier to address the naysayers coming out the gate, is that, hey, you're free to go this same route. But for those of you that want to try something different for everyone's benefit, because we sold it on, this is not the company's plan, this is our plan. I go to the same doctors and stuff. I don't want to pay more. I don't want to get worse quality of care. This is ours. This is not about company profits. So we all play a role in it. If we choose this path, there's a good chance that next year I won't get up and tell you we have a double-digit increase, or I'm going to raise your deductibles, I'm going to raise your out-of-pocket maximums. So use the carrot, not the stick, and you'll get far more participation.
And what was the feedback like in that open enrollment meeting? You can be honest.
They're like, yeah. And I'll tell you this, just one quick example. Even after preaching this week after week, month after month, a girl that worked for me had to have her gallbladder removed. And she went to one of our, well, first of all, she follows the right route. She goes to our DPC. DPC refers them to, Nurse Navigator. Nurse Navigator refers them to Solstice Surgery Center. They also do, DPC as well. But so she reached out to Solstice, set up a consultation with the surgeon, and said, I'm going to have my gallbladder removed. And so he went through the whole process. It was a great discussion based on what she was telling me. And then it came to the time, well, okay, so do you have a payment plan? Do you have something, how will I make payments on this? And he just kind of looked at her and said, what do you mean it's not going to cost you anything? And she goes, what? And I think tears came to her eyes the way she described it. And I said, yeah, Dawn, I'll use her name because probably nobody knows her in here except maybe a couple here. It says, it's what I've been telling you. If you go this path, it's not going to cost you anything. And so it just goes to show, no matter how much you continue to reiterate and repetition of it, until they experience it, they just don't believe it's true.
Okay, so I definitely have something to add there, because we have a different experience being public and being funded by taxpayers' dollars and having a school board. right? So I have a 7-member school board that you have to educate on this. So number one, we have an employee benefits advisory committee. That committee is made up of support staff, professional staff, staff on the insurance that have family plans, single, those that don't have insurance. It's really the goal is to get, or health insurance. It's a goal to get a wide lens. So that group worked with us throughout this entire process. And throughout that, like, okay, what's the temperature check? Where are you at? And when I heard from one of the members, hey, we cut coupons, we're into this, as far as like chasing the zero, I think I could tell that, okay, in education, I think we're really on to something here, especially when they started to figure out and connect the dots of the DPC, the downstream, and potentially spending nothing. Another thing that worked out really well for us, and Steen mentioned how you moved people over to your plan. We had a high deductible health plan, and then we had a traditional plan. What the people were paying for the traditional plan here for us, you had to buy up the difference. Well, when we moved over, you cannot have a high deductible health plan and this benefit because you have a DPC that charges nothing and a downstream with a zero. So we had to chop the high deductible health plan. So we're now no longer contributing to HSAs, which was a big savings to the district. And then everybody who moved from that high deductible health plan, we didn't want to sell it to them as, oh, by the way, get ready, you're going to pay a whole ton more. So we did a financial study, and we actually had everybody from the traditional plan, they went to the rates of the high deductible health plan, pretty much. Huge savings to them. Okay, so with all that said, the employees did not feel the pain then. We didn't have to sell them on that. And then we got to tell them, here's a self-fund health model. This is what it's all about. So just to add to that, this year, just finally after getting our last rebate check, we actually, instead of getting a $270,000 increase, we saved from the year before $5,000. I think that's pretty amazing for year one, right? Mm-hmm.
Yeah, that's amazing. So let's talk about ownership. When I was talking kind of about this myth busting idea, there's this idea that self-funding is just so much work, and there's definitely work involved. I personally believe it's worth it, but I'd love to hear you talk about what ownership looks like day to day for you and other members of your team. How do you own this plan, and how you integrate with it and interact with it, and how your team does?
Okay, well, that's a great question for me to be answering because in the beginning of it was like, is Scott doing this to us? Even though I had the committee, it went to the board, all of that, it's like, he's doing this because he's always up to something, right? Well, as a public servant, it's about taxpayers' dollars and doing right by kids and getting as much money to funnel to kids as possible, right? And school funding is tough in Wisconsin, everybody, but that's not why we're here. Okay, so really, it was that benefits advisory committee that helped to tell the story. It was my HR office that helped to tell the story. And even in my own small office, there was a little bit of, yeah, we're going to see how this works too. So I knew that it was super positive when probably a quarter into it, the chatter changed and the excitement changed. And the people who were questioning, am I going to bring my kids into this because they're college kids and they're on different parts of the state? Am I going to bring them into this DPC model, yes or no? And now they're all there and they're happy and they're excited. So when the story flipped with some of the naysayers, I knew that was good stuff. But in the beginning, absolutely, the leadership is everything. Storytelling is everything. Helping when that first bill comes in and it's all jacked up and it's like, oopsie daisies, and you owning it right here, the people at the head helping to problem solve that. That makes a huge difference there. So really, leadership is everything, but it can't just be one person. It has to be a team, and it's a lot of storytelling and support.
Yeah, and ownership is never taking a break from it, from the education, from the awareness, from helping employees. Because a lot of times, even though we have the great team of nurse navigators and we have the DPCs, these folks trust you and your HR team probably more than they do a third party that they don't know yet. So get ready to have folks come into your office. It becomes somewhat of a routine basis. but make sure you're directing them to the nurse navigator. She mentioned it, I think, on the video. One thing employers can do is make sure that the nurse navigator is part of the plan, part of the system, part of the communication channel. So it's not something new and they've never heard of. And we just recently had a health fair where they were able to attend it was our first one, and it won't be our last. We'll have them annually now. And our employees got to come in and meet all of these folks that maybe they have email exchanges or phone calls with. And it just, once you have that face-to-face relationship with someone, everything changes. But ownership is not taking your gas off the pedal, not losing sight of what the goal is, holding yourselves accountable, your employees accountable, and your partners accountable. And that means when an issue arises, this is not self-fund health's issue, or this is not R&R's issue. This is our issue. And I'm going to jump in, and I have many times, probably when I shouldn't have, but I take full ownership of it. And I've introduced this unique concept to our company, and I don't want to see it fail. So I take a particular ownership and interest in it, and I probably always will. But now I have a willing and able HR manager who's also innovative, and she's going to carry, and she's going to hopefully develop the same passion that I have now, which I didn't have 2 years ago, because I truly viewed fully insured plans where I've got no control over it. It's going to go up all the time. It's one thing I do know. So I'm not going to put a lot of mental energy in trying to address this. I'm going to, yell at my brokers to go negotiate the best 10% increase you can get me. And all of a sudden, I've learned what's behind the curtain, and you've heard a lot of it in the last couple of days. And if it doesn't make you sick and angry, I don't know what will. But anyway, I've become kind of a nerd when it comes to healthcare now, and I'm going to continue that path. And anyway.
Yeah, I agree. We're like converting CFOs into healthcare nerds. That should be our tagline for next year.
This is the third conference I've spoken to at in 6 months.
Yeah.
And I got another one coming even. It's fun. It's
I'm
exciting
available
stuff.
for hire, but I'm not free.
You guys have your own language, that's for sure. I have Ed speak. I could bore everybody with. You have your own insurance speak, that's for sure. Catching on.
I'm scared to ask this question, sort of. But I think it's important to tell the whole story, right? You guys have said this is not a self-fund commercial. It's also not a commercial for self-funding the concept. It's really about telling the whole story. And I've shared a couple times, I think when we pretend like everything's perfect, it sort of cannibalizes the credibility of a model. So I want to talk about, I want you to talk about a time where something broke in self-funding, and you had to roll up your sleeves and work to get it resolved, and talk a little bit about kind of who was in it with you. How did it resolve? You can be as specific or general as you'd like. It's probably best if we don't name names, although I could come up with some. All right, do it. He's going to do it. I'm not doing it, for the record.
Yeah, don't do it back there.
In video.
Yeah.
I'm only going to speak to facts.
Okay, I guess it's my fault for asking the question. But
that was a good one. No one knew what he was saying.
Yeah,
he said
give a rhyming name.
Charlie, should I do it? You're my legal advisor here.
Yeah. Just make it rhyme really well.
We met for like half hour a couple days ago, so Steen's is way worse than mine, so he can take the lead.
Okay. Yes, sir.
He's not going to go to ERISA prison, is what I heard.
That should probably cost me a pretty penny. There goes our healthcare savings, defending the CFO for defamation.
That's only if it's not true. So if it's true, you're good.
Yeah, I'm only going to speak to facts. This is not. And you heard Jonathan up a minute ago talk about changing TPAs. I think 6 or 7 he had gone through, and I guess I had always assumed the TPA. Again, this is all new to me as well, so I'm learning the partner roles and what they do and what their expertise should be. And third-party administrator to me just meant someone who processes claims. I think we mentioned it before. It was how can that be difficult? If you haven't done it or been part of the system that does it. There's a lot of complication to it, and not every TPA is the same. And that's why you should do your homework when you're selecting one. But my particular nightmare story was with my TPA. I won't say names, Vittoria Health. But anyway, so Vittoria Health had, as our TPA, they ended up just giving you a litany here of things. Processing claims late. You give them access to your bank account so that they can efficiently debit you for claims. So we're getting debited for, I'm seeing charges go through the bank that don't tie to the funding notice, that they can't provide me with backup data. I'm getting duplicate claims that I'm having to detect and catch. And I'm like, wait a minute, this is, when you hear about self-funding being a lot of work, only if you don't have the right partners in place. And I promise you, I spent months with the same Groundhog Day, week after week, trying to sort out billings. I eventually had to cut them off and not give them access to the bank account anymore because they clearly had no responsibility for your funds. What made it worse is that when you escalated it, the leadership within the company, all the way up to the CEO, did not give a shit about the rat hole that they were taking us down. And how many resources were being consumed. And I actually, unfortunately, it was the messenger, the account manager that I was working with that had to get the blunt of my frustration. But I quickly realized they're working in a process that they hate. And we even saw turnover in that 6-month period, which I'm sure that person that listened to me on a daily basis about how awful they were probably said, I'm tired of this. I'm working in this mess. I'm getting out of it. I'm going somewhere else where I don't have to listen to irate customers. But the worst part was they did not have a plan to improve it. With all suppliers, providers, you're going to run into difficulty. You're going to run into snags. And it's how they respond to those issues that determine whether or not you've got the right partner in place. And again, not mentioning names, Vittoria Health, but if you do run across, and I will say this, and I'm not even going to try to defend them or say in all fairness, but it was the result of an acquisition. You heard him, Jonathan, mention, one of the reasons why he turned over or why TPAs, fall on their face sometimes can be through acquisitions. And this was a scenario where a TPA that Self-Fund Health was familiar with and performed quite well for them and had a good reputation had gotten acquired by, again, not mentioning names, Vittoria Health, that they didn't know anything about TPA. I think they were a health plan and they wanted to add a TPA to their portfolio and try to capture more revenue that way. But, it's an example of them buying something and breaking it. And you're on the blunt end of that. So anyway, the way that we dealt with it, I think to my surprise, Mad Dog got involved in it over here. And
It's
you
true.
think I busted balls. She crushed them. So,
Yeah, and fixed it though. Fixed it as well, right? Like it's
yeah, we fixed it
pretty
by,
close.
yeah.
Yeah.
We fixed it too by,
Cup
and
half full.
the most painful part was the last, and there really wasn't, you have to have a run out typically, and it was 6 months long, and I'm like, really? I got to put up with another 6 months of this, but by that time, I think she had done her work and things were a little bit more under control. They didn't have access to our bank accounts anymore, and I required very detailed information and backup before I transferred any funds. So it was just a matter of kind of waiting it out, but we fired them so quickly.
So you have a January renewal?
Pardon?
You're January, right?
Yes.
Yeah, we're July. Okay. So we came into the dance a little after, and we were with the same partner. And, it was actually kind of nice not getting a bill for a month.
And then
And then next thing you know, money just starts getting withdrawn. You don't know what's going on. So yeah, I know at a different level, I do know that dance. And then working with Ben John, he's like, well, with the new clients, they're all going with a different TPA Yuzu, who we've heard about. And we love you
big
guys.
shout out.
Absolutely amazing. It truly is amazing because it makes the whole self-funding world easy. Now, the one part with it is you guys have us write a big check because you do require maximum funding just for the safety piece. And I think that level of transparency is important to know because as a public school, that's a big number for us. Like, whoo, that got real quick when we had to do max funding. But, I'm going to turn that frown upside down because working with them, we had built up so much money that we had exceeded the FDIC guidelines, and we actually had to actually only pay fixed fees 1 month. That's how well we were doing. And then there's another time around. Yeah, thank you for that. That's good stuff. And there was another month too also. So continuing that partnership, that's the goal. That is our goal, to continue to see how many times can we just pay fixed fees because we have such a pot buildup. That would be an ideal place. But it's doable, like we've experienced it.
Yeah.
I want to jump in one more time. We just shout out to Yuzu, but I got to say this. Yuzu is probably sitting back going, we will take every Vittoria Health customer we can find because you've set such a low bar. And we're going to be heroes no matter what. But in all fairness, all we got to do is pay them timely and accurately and provide good data and reporting. Again, it's easier said than done. And so far, our experience with them, 8 months into it now, has been great. And the reporting and the accuracy and the service and responsiveness, all of the above, nothing but a pleasant experience. So thank you for, changing my whole thought process of TPAs.
I guess because I don't have as much of a wowzer experience. I mean, that was rough in the very beginning for a few months, but we figured it out. I would say like in the very beginning, I was frustrated because I wasn't seeing as much DPC usage. Because hey, we sold this, come on, let's go. And then you start to get reports and people are not using the downstream and they're getting a colonoscopy. But the exciting part was we're getting data. Because to be fair, prior to this, I have nothing to get frustrated about because I don't have any data, right? So people are getting colonoscopies that cost, we'll say $5,000, and it really, if they were using the downstream and the preferred network, $2,000. Like the savings right out of the gate. So I guess to me, it's not like it's a disappointment because I thought we got this, but I'm not a patient human. And now I see we are catching on. We are making movement, and we made some decisions with co-pays, and now kind of nudge them a little bit. We didn't have to do it, but it's a natural when you have your DPC, that partnership, and they're doing a good job just to make some plan design changes.
Yeah, I actually felt like I was getting a colonoscopy weekly working with our previous TPA.
I don't think you mentioned their name, but
With no anesthetic.
it's a good transition because we're trying to let people out here at a reasonable time. So I'm kind of going back and forth between these two questions. But what have you done to activate employees to take ownership of their healthcare choices? So the reason I think this is an important question to get to, and then I have a really fast one at the end, is I do think that there's in my 10 years of working with employers, it's not just people in Wisconsin in this market that are nervous about having those conversations. And sometimes it's not even the hard conversation about a big medical thing. It's genuinely just talking about your health care instead of just the plan we offer. So has that been a struggle for you? And kind of how do you tackle that, and how can you help encourage your employees and their dependents to really take ownership of their engagement?
So I really am trying to create a culture of wellness in general, not just a culture of just health insurance, right? But overall wellness. So we ended up partnering with an organization called Core Wellness to support that. We had some savings, so we repurposed that. So we actually we have an app for that, but we intentionally built that as a user-friendly, meaningful, daily feedback opportunity for our staff. So I think that's one of the things. I think having regular access to, there's a DPC right in town. He's our medical advisor for the school system. There's a real partnership there. So we did our biometrics, which are a requirement, like health risk assessment, biometrics, yay. Well, we did that and had everybody go to the DPC. We did it there. And just naturally, hello, nice to meet you, check out the facility, we're gonna do it anyways. So, and typically they came into the district, but that I think made a big push for engagement. And then in the state of Wisconsin, unions are starting to have a little bit of movement, and we have a union that's very positive. They are not official. Well, yeah, they are actually. A year ago, they became an official union. And when they meet with me, we talk about health insurance, the trends, what's happening, and they're the champions of trying to get that forward, because they literally say to me, hey, if we do really well with insurance, you're going to give us a raise. Right? And reality is, I'm just going to try to keep more staff because that's where we're at. And they did get a raise too. So I think this year, I'm really pumped about the new reports that are coming from Self-Fund Health. We had a meeting 2 weeks ago. Exceptional. Like really meaningful data you can take action on. We're going to have monthly meetings with our broker and the Self-Fund Health team. Like, to me, it's transformational, that kind of stuff. So I think talk to me in a year about that, and I'm going to have a different response. But already during our opening in-service, everybody in health insurance is going to have a meeting because we're going to celebrate what we accomplished and say, but we're not there yet. Okay, so we're going to keep the doors open of this district, and here's how we're going to do it. We're going to do this together, and yeah, we're going to make sure you get raises.
Yeah, love that.
I use bribery. So you would be amazed what people will do for a $100 bill. So, we went effective January 1, and so I ran a little incentive program and you had a little form that you'd have to fill out. But anyone who's, any covered person, I guess, that employee or a member of their family that made an appointment with our DPC could get a $100 bill. And again, I encourage you, there's ways you can do those kind of incentives, but do them where they're more personal, meaning there's a bill involved versus, hey, it'll be included on your paycheck. Because there's so much. Now, I had an ulterior motive. So in order to get your $100 bill, you had to come see me, and you had to fill this little form out that just said, who did you see and what date you went to. I made it clear, I don't want to know why you went. I really don't know why you went, so please quit sharing it with me. But anyway, they would have to come in, and the reason why I made them come and get it from me is so that I could hear what their experience was like. Because this is all new to me, and again, holding your partners accountable are about, what are your employees, what is the patient experiencing? Because I knew the key to success to the plan was utilization, but the key to utilization is their experience. So I wanted to hear good, bad, and ugly, and I said, hey, I'm going to give you this $100 bill no matter if you trash this or not. Matter of fact, I would prefer that you tell me if you had a negative experience and not sugarcoat it, because that's the only way we can make it better. So that was one way to kind of engage them, but you want to do it very quickly out the gate because you want to get them introduced to this new system, this new plan as soon as possible, not when they actually, so I mean, people are making, annual exams. I had, burly men that were, 50 years old coming in going, I hadn't been to the doctor in 20 years or whatever, and damn it, they went for that $100 bill, believe it or not, but then they found out they had some underlying conditions, and they were able to actually start treating them, and they were aware, and it didn't cost them anything. They walked in and they walked out, and no one sent them a bill or a copay.
Yeah. Mm-hmm. Yeah. I mean,
we have a pretty significant premium reduction for hitting the wellness initiative, and that does require them to get a physical. It does. So we've had this kind of built in. So I am looking at opportunities for cash, by the way, too. So that's down the road, because absolutely, if you look at putting $250 out and saving $2,500, do the math.
Yeah. I know we're at time, but I want to ask one question, but obviously the three of us don't like to talk, so we'll have to,
Yeah, right.
We'll keep it to a sentence. I just want you guys to fill in the blanks. So I'll give you a second to think about it, but the question is, self-funding is working for us because...
I'll take this one. A great set of partners that are aligned with our goals and strategies. Innovative, you've heard a lot talking about brokers, but it does truly start there because they're your consultant, they're your guide to kind of get this process started. And you need to take a close look at your brokers if they're, I don't care if they've been with you 30 years and you have a great relationship and they give you tickets to games and all that. If they're status quo people, and we can recognize who status quo people, it's not a bad thing, but you recognize them, and if they're status quo and if they're not bringing you innovative, creative ideas, even in a fully insured environment, they're probably not going to do it in a self-funded environment, and that's when you need it the most. So you may just have to keep that friendship, that relationship you have with them more on a friend basis and maybe not on a broker basis, but get the right partner there who can see the vision. Same thing with all your other partners, the TPA, the stop-loss carrier, the DPC, and of course, the beauty, we keep plugging the self-fund health, but that's because you've heard all these different pieces of a self-funded plan, and it can sound very overwhelming and very time-consuming. But what self-fund health brings to the table is a one-stop shop for all of those things. Now, God bless Philip that was up here from Gamber Johnson. That you saw the energy he had and the drive and the passion. So they went out and did a lot of these things on their own, but some of us don't have the resources or the energy or the knowledge to do it on their own. And it's a great place to start at Self-Fund Health because they've kind of perfected it and they provided the network that exists so you're not having to go out and establish contracts with 20 different providers.
So I was thinking keeping it simple. We cut coupons, right, is what I said earlier. So I guess it's a cultural piece. So like chasing the zero, like there's value in that to the staff. And then the other part then kind of to align with what Steen just said is that take Self-Fund Health out of it. The model is DPC is the forefront, number one. Got to have it if you're going to do self-funding as far as I'm concerned. Next is you have the nurse navigators, people truly in this caring place who care about your people, and their job is to help save money for the employer and the employee. Come on, that's phenomenal, okay? So you have that. It works then third because they are working and it's still being built. So I still feel it and see it. This preferred network and these relationships are still being built. Okay, so you still sometimes got to get a car and drive. So, but I do believe the more this picks up, the more access is going to be available. That's why I enjoy coming to things like this, because, hey, if more people join into this network is going to grow. It's going to benefit me and my staff, and of course, I'm going to come speak as much as possible about it, right? So I think it's that preferred network piece there. And then last thing, no matter what, access. My staff have the widest network in the state of Wisconsin. Even though I'm promoting all these things, I still get to keep staff that have these huge commutes because they could still go if they choose to. They still have it. And then to affirm what someone else said, mental health access. Right now, our insurance has more mental health access than any other insurance that I've been on. And at a time when our kids are in crisis in the United States of America and Wisconsin, that is an absolute win. And I need to give them a shout out for that.
And change your mindset. You heard it, I think, at the beginning of the conference. Change your mindset from your purchasing insurance to your purchasing healthcare. And once you make that change in your mind that you're purchasing healthcare and not insurance, it changes everything for you.
Yeah, so much of what we talked about, you could boil down to manage the risk first. And that means finding the right partners, having the right plan, being strategic, and then buy insurance for the rest.
Hey, we had cancer this year on our plan, multiple cases of cancer, and we still came out under what we were spending the year before. And we had a great renewal.
Well, let's hear it for our employers, Scott and Steen.
Thanks for staying around.
Thank you so much, both of you. All right, slide up.
All right, well, a couple questions and we'll still end early. So the first question is, do you reimburse mileage or arrange travel for employees that need to travel for services? I'll give a general self-fund health answer. The zero-tier incentive is the biggest driver. When there are special cases, particularly travel outside of states and that sort of things, we always want to have those conversations. It always comes down to what it is, how it is, what's the problem, what's the solution, where's the provider, and we work through those things. So I don't think we need to touch on that. Talk to us more about that. This is a big one though. Was there any negative feelings? So this is for Scott. Was there any negative feelings about losing their HSA eligibility? I will say personally, this is the biggest sticking point that we run into with employers and brokers. And this is where we would not be a good fit. And we tell people that, and it's okay that we're not a good fit, is if they don't want to lose their HSA or they want to offer multiple plan designs. We are looking for simplicity. We are looking for efficiency. That is how the self-fund health plan is built, and that's what I believe the future of healthcare needs to be. However, people like different plan designs. They like their choice. They like their HSA, especially if the employer is contributing to it. And so this tends to always be a pretty large hurdle in the change to our plan in general. And so Scott went through that. Yeah. I went through it with him because we had to meet with the board. We had to meet with the benefit team. We had to meet multiple different people. And so how did you manage that?
Interesting enough, there was zero kickback on that topic. And I think probably because like our staff are kind of in two buckets. Either you're right about to retire or you're new. And so then these guys, they maybe have built up their HSAs and they're ready and thinking about retiring anyways. And these guys are like, yeah, I'm never going to save up that HSA because I'm using that insurance every single year. So we had an advisory group. We told them this is what's about to happen. Where are you at? We did not get any negative feedback, but I think it was because we actually went to a richer benefit and didn't upcharge them, right? So I think
froze the premiums from the previous year.
Yeah. So I think that was a deal. That was a concern. I do miss having this extra kitty because you can only put so much in your flexible spending account. So there's a lot to educate. Right? Educate. So we just made sure that they knew you have an FSA. Max that thing if you're going to be, if you need to. If you don't use it and you're building it up, then be careful.
Well, the one thing I will say, so if any brokers here have worked with public entities, it's a different kind of organization to work with. Yeah. And because there are so many layers, right? There's the boards, there's the leadership, then there's the benefit committees, and there's the this and there's the that. But so it's essentially it's more work, right? From our standpoint, from your standpoint. But the beautiful part about it with a transition like this is that by the time the decision is made, you've hit almost every layer of the organization and educated them on what the transformation is going to look like. So everybody's going into it with eyes wide open, right? Rather than more of
the process.
Yes. Period. Rather than like a top-down approach. So as much as, at least in the industry, you talked about the ed industry and the insurance industry, everybody's always like, schools, counties, they got all their, there's a great process about it that really helps with this transformation.
I have two isms. It's all about the process. And second is don't make it a thing. Don't turn it into like a big event. Just, hey, celebrate it, tell the story, but don't turn it into some big event.
Question. Question. Where do you spend most of your time after your transition into self-funding? So how is the work different? There's still work. It's different work. How is the work different? Where are you spending your time on?
Repetition. You're kind of saying you don't have to come up with new ideas and new thoughts about how to get success of the plan. It's repeating what you know. Again, education, awareness, keeping it in front of everyone, post it everywhere, I have it in every communication meeting. When we go through the business results and everything, I always have a slide on the health plan to show, here's our utilization of the plan. So some people see, oh my God, we're, 60, 70% utilizing the plan. Then if they haven't yet, then they're encouraged to do so. We share a few, good news stories where people saved a lot of money, and you just keep it visible. There's a communication piece to it. There's a marketing piece to it. There's an education piece to it, but it never stops.
It's the faucet drip, not the fire hose. And this is the next question.
Learned a lot about coding.
What's that?
Learned a lot about coding. which
Coding?
I didn't want to know. Yeah, like, okay,
Oh, like medical
somebody
coding.
goes in for a colonoscopy and it's supposed to be a routine one, and instead it gets charged as like actually like a procedure more exploratory for something, and it gets charged a whole nother level, and the
Say more.
employee's getting a huge bill.
Right.
Who do you think gets that call? Right here. So it's a lot of lessons learned, and just easier to respond now. Those are the things. So I
and-
get to do that.
This next question fits into this. Like, how is the open enrollment different from being fully insured to self-funded? I mean, your employees, they've lived through the past 20 years just like you have. They have seen the $100 deductibles go bye-bye, and they've seen the $5 copays go bye-bye. And even though they might not know all the healthcare finance stuff that we're talking about here, they know something's up, and they know their money. Like, they're smart enough to know they're getting hosed, right? And so when you just say it like it is at these open enrollment meetings, and you tell them, hey, we're going to give you this for free because it's costing the plan, the other members, right, $500 versus costing everybody $5,000, they get that. Because they're going on Facebook Marketplace and they're buying a four-wheeler, right? And they're driving up to Hayward for one that they got a really good deal on. Don't tell me they're not. Right?
So I've been here for 2 days. I don't think something that came out, which I think is really important, is like in the self-fund health model, when you're working with your DPCs, any prescription that DPC can fill is free, too. So there
Yes.
are a lot of staff who literally don't end up spending anything if they use that DPC partnership. So that word of mouth makes it, right? So I think that's really important. So by the time the open enrollment meeting comes, like this last year, or then it was really important, is Self-Fund Health sends a nurse navigator to the open enrollment meeting to help educate. Okay, in the past, the broker comes, tells about changes. Yeah, we increased this, we took away this, we're doing that. Don't smoke, don't do this, right? Like it's just so different is the thing. So these open enrollment meetings are way more dynamic, and there's a partner right away in the dance with us, and it's not Steen and I up in front. There's multiple people there telling the story.
So last question, what recommendations from brokers have been the most helpful for you in this process?
For me, was to take the leap. It wasn't my first choice. I wanted to, again, walk before I ran, and just naturally somewhat being, I guess I wouldn't consider myself risk averse, but this is a pretty big leap. And I think it was just the confidence from the broker to, and show me the numbers. It wasn't just, hey, I've heard this is a great concept. Tammy is a very analytical person. That's one way that we've connected, because we're very data oriented, and I don't like making decisions without data. So we were able to kind of model some things out. And again, as I started this, it developed some confidence for me to move forward on it.
So our new broker brought this model forward, and what I appreciate about Self-Fund Health is whoever brought that model, that's who you're going to work with. I respect that big time. And our prior broker told us that self-insurance really is not a good fit for us until we said, hey, we're looking at this. And then next thing you know, we have a self-insured option being presented. And we had already learned so much about this model and all the tiers in it. And what was presented was really a pharmacy, a PBM, that's good stuff, bringing in a PBM to help do some interventions, right? And we're going to get the coupons, the kickback, all that stuff is going to come to us, which was huge. But that was it. And I just thought, that is not innovative. That is not going to break the mold. So I would say for me, it's the new broker bringing this idea forward. And then now I can see the ideas cranking for helping us with the data and helping us to have regular meetings with the staff to educate them. The engagement, that's what's coming. I think we had a decent or good year for engagement. I know we can do way better.
So over and above everything, the reason that they are successful is because of who they are and how they're leading their organization. I want that to be perfectly clear. What I think Self-Fund Health's value is from an outside perspective joining this organization is they are simply making it easy for them to manage the change. That's the big thing, because at the end of the day, it's not what we're doing that makes us unique. It's how we're going about doing that efficiently with the simple model that we're putting in place. And I think they're great examples of what you are potentially able to do in your organization.
Can I just leave with one thing again? When we talk about what makes it successful and what doesn't, what's the most important thing? When you launch something like this, first impressions mean everything. So the first impression at your DPC, someone goes to the DPC, and I've had it happen, but if they go to the DPC and they have a bad experience, you will have a very difficult time reeling them back into the preferred network because they've had a bad taste of it. The first phone call they make to the nurse navigators, or either they don't get a response or maybe their response is negative, you will have a hard time reeling them back in. You may have lost them forever. Now, fortunately, the nurse navigators do a fantastic job because that was another part of the organization that I thought was more administrative in nature, but these are all accredited nurses with a lot of good experience. And so when an employee makes a phone call to them, they're not just getting directed to somewhere in the network. They're actually getting healthcare there on the phone. They get the empathy, they get the guidance, and all of the above that a nurse brings to the table. So again, shout out to the nurse navigators, because you determine the success of the plan, because it's all about the experience.